Tidelands Health. Better health begins here. It's time for Better Health Radio, brought to you by Tidelands Health. Here's Bill Klaproth.
Are you suffering from a shoulder condition that's affecting your daily life? Do you have pain when reaching up in a kitchen cabinet or washing your hair or even sleeping on your side? With us is Dr. William Greer, an orthopedic surgeon with a sports medicine subspecialty at Tidelands Health. And Dr. Greer is also the team physician for the Myrtle Beach Pelicans baseball team, which is a farm team for the Chicago Cubs. Dr. Greer, thank you so much for being on with us. Let's jump right into this. So what is the most common problem you see when it comes to shoulder pain and injury?
Well, I think there's a lot of varieties of causes of shoulder pain, but primarily the most common complaint that I hear from patients is loss of motion and pain. Oftentimes this occurs with weakness, with or without injury.
And how do we get there? Is it mainly injuries from sports, work-related injuries, or does old age just take its course and just wreak havoc on our shoulders?
Yeah, well, I think that you hit the nail on the head. There's different causes, and for instance, in younger individuals, they're more apt to have had an injury or maybe an overuse type phenomenon. For instance, a youngster playing baseball that may have thrown too many pitches would present with shoulder pain, or a football player that were to dislocate his shoulder certainly would come to my office with shoulder pain, whereas I might see a construction worker that does a lot of drywalling and sheetrock that would have shoulder pain over a longer time frame, and certainly there's our active elderly folks that may have an arthritic condition that presents with a nagging pain that gets worse with time. So those are different ways that shoulder pain may present, but the common link between all of them is pain.
And what is that pain? What is the most common pain? Is it just general in the shoulder, or do you see a specific area where pain usually manifests?
Well, most of the time, pain that is caused by a shoulder condition would involve the shoulder, of course, but with that, oftentimes folks with a shoulder condition would have some radiating pain to their arm. It's not uncommon at all for patients that see me say, well, doc, it's not really my shoulder, it's the mid portion of my arm or the humerus region, but most often that pain is generated closer to the neck or the shoulder. The shoulder joint is a typical cause.
So when is it time to come see the doctor?
Well, I think that, for most musculoskeletal injuries, it's typically time to see the doctor whenever you have instituted the simple things at home, the rest, the ice, the elevation. And if you have pain that persists after a day or two, or certainly if your pain's getting worse, it's time to be evaluated. Any pain that is worsening over a week, clearly you need to see a physician and an orthopedic surgeon with specialty in shoulder conditions would be, somebody that could help.
So there's a lot of moving parts in shoulders. We all know that. How do you diagnose certain areas, and what's your most typical diagnosis? What's the most common problem you see?
The most common problem that I see here is rotator cuff issues, and the rotator cuff is a group of muscles that's the primary initiator of shoulder motion. Certainly there could be an injury which were to cause a rotator cuff tear, or more commonly we see more inflammation or bursitis around the rotator cuff. Folks would present with worsening pain and decreased motion, and it's pain that typically bothers people at night.
So sleeping on the side and reaching for some things, that's when you kind of get that radiating pain. If it's not a tear of the rotator cuff, is it something that if you don't use it, it can heal on its own over time?
Certainly, mild cases can resolve just with, what we call activity modification, or just, babying that side. Mild cases could resolve like that. Certainly more advanced cases may not, and may require additional treatment, medications, therapy, those sorts of things.
So speaking of treatment, tell us how you go about treating someone that may have a bad rotator cuff. There's probably different varying levels of injury. How do you go about determining that, and how do you treat it?
Sure. So, the first thing we would do is perform a good physical examination in the office, and that's something that, in my opinion, is the most important thing, is to examine the patient, hear what the complaints are. Oftentimes the patients, if you can listen, will tell you exactly what's wrong with them before you even get any tests. Most of the tests that we get confirm what we think, and we would take x-rays in the office. X-rays are useful to determine whether there's any joint destruction or arthritic change to the shoulder. And certainly if I were concerned about a rotator cuff problem, which is soft tissue, oftentimes an MRI is obtained, which helps guide whether or not there's a large tear or a smaller tear, and would help me make recommendations as to the varying treatments. Clearly, if someone were to have a large rotator cuff tear and were having worsening pain and had failed a course of conservative care, which would be medications or even injections and therapy, surgery is an option. However, we reserve surgery for cases that just don't improve with non-surgical treatment.
So when you go in and perform surgery on a shoulder, what is the recovery period, and what's the efficacy of that? Can people expect to regain full use of their shoulder with minimal pain, no pain? What's the general prognosis with somebody that's having shoulder surgery?
So I think it varies for the particular condition. For instance, a young person that dislocates their shoulder, where the shoulder comes out of socket, that requires a surgery, has an excellent recovery rate with very minimal recurrence and typically has a normal shoulder. For somebody that's had 20 years of shoulder pain, that's maybe neglected themselves and basically has a paralyzed arm, we could certainly improve their condition. Their shoulder may not be normal in the sense of having full motion, but we can minimize the pain and improve the function. By and large, most of the surgery that I do is done arthroscopically. Arthroscopic surgery is minimally invasive surgery through usually 3 to 4 quarter-inch incisions where a camera is inserted into the shoulder joint. I'm able to address a lot of problems in the shoulder as well as even outside of the shoulder, repair rotator cuff tears, fix instability issues with the shoulder with this technique. And the recovery varies, but typically most shoulders recover from 4 to 6 months afterwards, and it varies depending on what's done and how much therapy is needed.
Dr. Greer, you touched on something there. It sounds like you shouldn't wait if you have shoulder problem. You mentioned somebody that waited for 20 years and just lived with it. There's probably not much you can do at that point. So if you are experiencing shoulder pain, best to see the doctor early than wait and try to live through it. Is that correct?
I think generally speaking, that's a great recommendation. Clearly, it's not wrong to wait a day or two to see if your symptoms resolve, but I unfortunately do see patients that have have a neglected shoulder for a variety of different reasons over a number of years, which makes treatment options very, very selective and difficult, and the recovery is often more problematic. So addressing the condition sooner than later is always beneficial.
For weekend warriors who want to go out there and play sports and throw the softball and baseball and throw the football, are there stretching exercises that you recommend that somebody should do to loosen the shoulder up first, and do those help?
Yeah, I think it's pretty clear that if we had a group of individuals that very rarely are engaged in any overhead activities or throwing, and we would want them to start off with maybe a light toss instead of trying to throw as hard as you could. For instance, throwing somebody out from center field to home plate on a first throw would be probably detrimental to that individual. So there are a bank of stretching exercises as well as warm-up routine that would likely help and try to minimize any injury in those sorts of individuals.
Okay, so warm-up and stretching is important. Dr. Greer, very informative stuff here today. What haven't I asked you? What else do we need to know about shoulder pain and shoulder health?
I think the large majority of shoulder conditions can be treated non-operatively, first and foremost. I think getting a accurate diagnosis helps guide this process. and I think that we can expect to have a normal functioning shoulder throughout the latter years of life if common sense as well as good medical care is provided to the individuals.
And that's really important. And for all of us who will be grandparents someday, you want to be able to lift that kid up. And if you got bad shoulders, that certainly is not conducive for that. Dr. Greer, thank you so much. Can you tell us why should someone choose Tidelands Health for any of their shoulder issues?
Well, here at Tidelands Health, we have a comprehensive panel of experts from physicians, physician assistants. We have physical therapists, as well as the latest technological aspects in the operating room to treat the whole spectrum of shoulder problems, whether it be simply an office visit and therapy or a more involved surgery. We have the ability to deal with.
Dr. Greer, thank you so much. Very, very informative. And for more information about Tidelands Health physician services and facilities, visit tidelandshealth.org. That's tidelandshealth.org. This is Better Health Radio. I'm Bill Klaproth. Thanks for listening.